One of the things that caught my attention in 1985, the pharmaceutical rep, I was a family practice doctor, came in and showed me this real pretty pill that had like 18 layers. It was Prempro, and he said, look at all these different hormones. This is what our drug has in it, and we get this from horse urine, and you know, there's all these other estrogens that we really don't know what they do to the human body, but they must do something really good, and it just got my attention because I thought, well, this is really interesting. The human body has 3 estrogens. Your pill has 18 because that's what's in the horse. And that's what made me start wondering about, you know, what really are the drug companies trying to tell the doctors?
And no, it's not necessary.
The other thing we usually do when someone comes in, we'll check their estrogen level and progesterone level to find out where you're at. So we can logically say, this is where you're at, this is what would be normal expected for your age, is it low, and can we logically increase it with the bioidentical hormones?
Oh, I can't agree more. And to show you the power of Suzanne Somers and Celebrity Who Cares, I've been trying to get my mother-in-law on bioidentical hormones for about 7 years. I showed her all the studies. She's like, no, that doesn't sound like I want to do that. Suzanne Somers is on Larry King, and before that show is over, she's calling me saying, I think I need to be on bioidentical hormones. So,
well, I just have to say, though, she enforced me to believe in what you guys believe in.
Oh, I agree. I think it's that this is
don't say anything negative about her.
Oh no, she is. No, she has done probably the single best thing for bioidentical hormones of anyone. I totally agree. I totally agree.
I think we just wanted to emphasize that there was a few things in her book that we didn't agree with, but I think all of us, you know, really, yeah, no, but for the most part, what she has done has been phenomenal.
Oh no, I think it's the best thing that's ever happened for bioidentical hormones.
Go ahead.
Yeah.
I have to respond to that because I've been with Dr. Holtorf for about 3 years. I was the menopausal bitch from hell when I came in. No, seriously, I think it ruined a wonderful man I was engaged to. They did a lot of horrible things in my life, and I was the worst, and I have been up and down in some of my taking my things. I went in, I read the book, What Does Your Doctor Haven't Told You About Hormone Therapy or something. I read Suzanne Somers' book. I came in with a list, and let me tell you, his office staff will tell you, they are so nice to me. They're all going to heaven because of me. And how the things I've come in. And I came in with a list, and I came in and I said, nah. He agrees with Suzanne Somers. I've asked him about it. I saw Suzanne Somers, and I went back with my list again, and he is so nice to explain everything so I can understand it. And I've asked the same questions 3 or 4 times. And he's been and he doesn't go like, oh my God, you're asking that question again. He will explain it to you. He does it in words that you can understand. This was a little technical for some people because some of the things he had to say was technical, but he has never knocked Suzanne Somers. Like I said, I came in after the seminar again with all my questions. He explains, because I said, well, gosh, I'd like to have a period till I'm 80. Well, he explained why maybe I don't want to have a period till I'm 80. So I had to stand up because like I said, I have been one of their worst patients, I'm sure. But I'm really doing really well lately because we've got a lot of levels, and I don't have insurance and things, and he's worked with me on that. They've got the most wonderful little dog, too, that's in their office. But anyway, I had to stand up for him when you said that because he's really good.
With the breast cancer, in fact, we have a number of studies that show that giving estrogen after breast cancer, there's actually a trend towards reduction in recurrence. And it is definitely an option. It's a very individualized case-by-case basis. In terms of early dementia, absolutely. One of the best things you can do, there are a lot of other treatments as well for early dementia, and we do multiple pharmaceuticals and also natural treatments along with bioidentical hormones for early dementia. Yeah, very aggressive with that. Correct. Yeah. Yeah, it's very preventative and it's making the body work better. I mean, there's no set age. Everyone's different. I mean, we have people that come in at 8 years old because their pituitary shut down. I mean, so, you know, it very depends.
One other thing I was going to say with regards to breast cancer and treatment after breast cancer, many women, maybe women in this audience, have had breast cancer. The breast cancer is removed. And then the question is, you know, maybe 5 years have gone by and they're interested in hormone replacement therapy. What do they do? So the oncologist in general is very anti-hormones. Hormones kill you. Hormones kill you, even though why do 20-year-olds don't get breast cancer? So hormones is very complicated, especially with cancer. I think Dr. Holtorf gave an excellent presentation how natural bioidentical hormones don't cause anything. And the studies that he was talking about, we have in the office, we can show anybody, that demonstrate actually going on hormones can have a decreased risk of recurrence of breast cancer. So the hormones are powerful. It's very important that you have them in balance and at least bioidentical. I think you want to say something.
One of the things, I think the more we learn about the body, the more amazed I am at our creator that put us here. David Zavalia, who's a laboratory scientist in Oregon, does a lot of studies of hormone balancing, and I attended one of his lectures. And one of the things that he said that just really made sense to me is that estrogen is a stimulatory hormone, and it stimulates, as well as making women feel better, it stimulates cell growth. But progesterone, on the other hand, is very calming and it slows down cell growth. So if you're using a natural progesterone, it will balance that stimulatory effect of cell growth, and uncontrolled cell growth is cancer. So if you're taking a natural progesterone, it will slow that down.
Cancer post-surgery is to go on a hormonal deprivation therapy of monthly injections of Lupron to suppress the hormone production of estrogen. Is this something that could be done concurrent with that in order to counteract the instant menopause you get with those injections?
Take that one. Yeah, I know. Because the reason I say that is because it's a very it's a controversial issue, and there are a lot of things that I would maybe do, you know, to my family that I maybe wouldn't do for a patient, because the backlash you have, the oncologists would just go crazy and say, and so what is right medically may not necessarily translate sometimes to what we'd actually do. So, to give you a black and white answer, it depends. Yeah.
I have diabetes now all of a sudden, and I take Lipitor, and I've heard this cholesterol and all this stuff. I'm very curious about how do you test for all this stuff, and who do you go to, an oncologist or an endocrinologist, or because my OBGYN, I love her, but my GP is the one that told me to get off the I was on Prim phase for a while, and I just, I'm kind of up in the air. I've got cholesterol that's 400, and I've got diabetes, it's crazy, and so what do you do? Who do you go to?
Wayne, you want?
These guys right here. Prim phase is Premarin with progesterone. It's supposed to phase it out. They were losing their patent on Premarin, so they came up with Prim phase.
I can take that. Actually.